Good morning, Jesus. How are you doing today?
Good morning. I'm doing okay.
Good, good. I see we have you in for your root canal this morning.
That is correct.
Okay. How are we feeling about that?
Well, I'm a little bit nervous.
A little nervous. Okay. I see you did mark on your medical history. You get a little anxious with your dental visits. Is that right?
That is right.
Okay. Well, I promise we'll take good care of you today, and we'll try to make it as quick as possible for you. Okay?
Okay, sounds good.
Okay. So just a few questions from your medical history that I'd like to review. You did mark that you have had angina or chest pain in the past. Is that a past problem or a present problem?
It is present.
Present.
I was diagnosed about 3 years ago.
Okay, and are you currently under care of a physician for that?
I am, and
You
I'm
are.
also taking medication for it.
You are taking medication, okay. I have you down for diltiazem and atenolol. Does that sound about right?
I believe that's what
Okay,
it's called.
do you take those daily?
I do.
You do take those daily. Okay, and about how many attacks do you have, say, per month?
I would say about 2.
Two per month, okay. And is there something that stimulates those, that sets those on?
Yes. Whenever I have anxiety.
Anxiety.
Or whenever, let's say, I go up a flight of stairs.
Flight of stairs, okay, so some physical activity in
Yes, there you go.
Okay, okay, and what do you use to relieve those symptoms?
I do have nitroglycerin pills.
Okay.
And I did bring them with me today.
Oh, good, good.
They're right here.
I just want to check those and make sure that they're not expired for you. Perfect. They are just fine. I'll set those right on the counter in case we do need them, but I sure hope we don't. All right, and how would you rate your health? So you're in good health, poor health?
I think I'm in good health.
Good health, okay.
Aside from the fact that I have angina.
Okay, so maybe fair.
Yeah, I would say fair.
Okay, and have you ever been told that you have hypotension?
No,
No.
not that I can recall.
Okay, so just the anginal attacks.
Yes.
Okay, sounds good. And let's see, have you had anything to eat or drink in the past few hours?
I have.
Okay.
I just had a double bacon cheeseburger,
Yummy.
extra large fries, and a large Coke.
Wow.
So I'm pretty full and
Go
ready
big
for
or go
this
home, right?
procedure. Yes.
Okay, awesome. All right, well, is there anything else that you feel like I should know about your health or your medical history or anything like that?
No, I think that's about it.
Okay. All right, well, if there's nothing else, then we will go ahead and proceed with the procedure.
Okay.
Just get some of these things on real quick. So is there any occasion for going out to eat this afternoon?
It was actually my nephew's birthday.
Oh, how fun. How old is he turning?
He's turning 2, I believe.
2. How fun. Do you have a lot of nephews?
I do. I have 10 of them.
Oh, wow. You do have a lot.
Yes, I come from a large family.
Okay. How old is the oldest one?
I think he's turning 18.
Oh, so a little bit older. Awesome. Okay. Well, we're going to go ahead and sit you back now. Here we go.
Okay.
Okay.
Oh, hold on.
Oh,
Hold on.
is everything okay?
No, it's not.
Okay. Do you need to sit up?
Yes, I think I'm
Okay,
going to have
okay.
another episode.
Okay. Let's sit you up.
Okay.
All right.
I get this all the time.
Okay. Okay. Here's your nitroglycerin.
Thank you. Usually when I take this, it should help.
Okay. All right. All right, I'm just going to grab the medical emergency kit. And that has some extra nitroglycerin in it. And the oxygen tank, just in case you feel like you need that. How are you feeling? You doing all right?
I'm starting to feel better.
You're starting to feel better. Okay. We'll just give it a couple more minutes.
I can feel it's already taking effect.
Okay, good. Good. Okay. How are you feeling?
I'm feeling much better.
You're feeling better? Okay, would you like to continue the appointment, or would you like to go ahead and reschedule?
No, I get this episodes all the time, and
Oh.
usually I'm good with the nitroglycerin pills.
Okay.
So I'm already here, so I say we should just continue.
All right, then we will just continue the appointment. Jesus presented to the dental clinic with stable angina pectoris, which is chest pain usually caused by inadequate oxygen supply to the myocardium and is rarely associated with valvular heart disease, uncontrolled hypertension, or hypertrophic cardiomyopathy. Symptoms can often be worsened because of large meals. Angina is commonly stimulated by anxiety or physical activity. It is characterized by dull, constant pressure rather than sharp, knife-like pain in the left side of the chest. Discomfort may be described as pressure, burning, or choking sensation radiating from the thoracic area to the shoulder, down the arm, and to the neck, lower jaw, or tongue. Angina is considered stable if no changes in the frequency or severity have occurred in the last 60 days. Treatment of nitroglycerin usually is effective within 10 to 15 minutes. Attacks may vary from 1 to 15 minutes long. Those with stable angina pectoris are typically under the care of a physician and taking calcium channel blockers, beta-adrenergic blocking agents, and nitrates. Patients with stable angina pectoris may receive dental care, but appointments should be kept short and simple. Treatment of patients with angina pectoris is like that of the video. Terminate the treatment, position the patient upright, assess their breathing, administer oxygen at 100%, monitor their vitals. Nitroglycerin can be administered as a spray 0.3 to 0.6 milligrams or as a tablet, 1 tab every 5 minutes, no more than 3 in 15 minutes. Nitroglycerin dilates blood vessels to help the flow of oxygen and blood.
Two other forms of angina. We have unstable angina and variant angina. Unstable angina occurs during rest with minimal physical exertion. Patients suffering from unstable angina are going to experience similar symptoms as those with stable angina. However, the symptoms are going to be more severe and are going to last longer, usually more than 20 minutes and up to 30 minutes. Unstable angina is caused by constriction of blood vessels, usually caused by a thrombus or accumulation of plaque. In the event of a medical emergency with a patient suffering from unstable angina, oxygen should be administered immediately, followed by administration of nitroglycerin pills, 1 pill every 5 minutes, not to exceed 3 pills in 15 minutes. However, after the administration of 2 nitroglycerin pills, if the patient does not find relief, the condition should be treated as an acute myocardial infarction, and EMS should be contacted immediately. Another form of angina is variant angina. It is caused by a blood vessel spasm, abnormal heart rhythm, and it usually occurs at odd hours of the day or night. It can be triggered with no physical exertion or emotional stress. It is going to present with symptoms similar to stable angina, and it can also be treated with nitroglycerin pills. Vasoconstrictors are contraindicated with patients suffering from unstable angina and variant angina. Resources for this video are mayoclinic.org, Mola Med's Medical Emergency DVD, Medical Emergency Essentials for the Dental Professional. This video was filmed by Jesus Sandoval and Heather Claridge.